recording this session para at least ma-upload ko na lang dayon karon. So, let's now start our case conference with childhood disorders with the with group of Mr. Kamantog, Miss Kamantog, Karabakan, Cruz, Bevillas, and Talabok. Sige, you may have the floor now. Hello? Hello? Uh, Developmental Disorder Group? Ka mo? Hello? Di ko ka mo batikan.
Good morning, ma'am. Wait lang po.
Okay.
Okay, so good morning, everyone. We are about to report about the developmental disorder and disorder in childhood. So next slide, please. So the case problem. So Jack is a 7-year-old male grade 1 student. He is the only child to two parents, both of whom have completed postgraduate education. There is an extended family history of attention deficit or hyperactivity disorder or ADHD, mental concerns, as well as academic excellence. Jack is an intelligent and caring young boy who presents with significant potential to excel academically. In his spare time, Jack enjoys spending time with his friends and participating in physical activities such as swimming, running, and skating. He also enjoys participating in social events and is often invited to play dates and birthday parties. It is noteworthy that he did not know his address or home phone number, could not print his username, and recognize a few pre-primer words. While Jack interacts well with his own age, his parents note that he can be easily led and influenced by others. They also report that Jack gets upset when he does not receive recognition or feels that he has been ignored. His teacher notes that he sometimes acts socially immature and that he often demonstrates attention-seeking behavior. Jack describes difficulties with focusing and sitting still in class. He recognizes that he is able to hyper-focus on some activities of interest. However, he often has difficulty sustaining his attention at school. His parents and teacher indicate that Jack is restless and often requires reminders to help him stay on task. Next. He is described as constantly running around and presenting difficulties listening and following instructions. Jack's teacher indicates that he often blurts out answers and interrupts other students in the classroom. Jack recognizes that this tendency in himself, but says that he can stop in spite of his best intentions. Jack has always had challenges falling asleep and sometimes finds that he wakes up in the middle of the night. When he wakes up, he finds that he has a difficult time getting back to sleep, sometimes staying awake as for long as an hour and a half. His mother reports difficulties at home with following routines and remembering instructions. His parents describe emotional reactivity as well as confrontational behaviors demonstrated both at home and at school. His teacher notes that Jack is very defiant towards listening to instructions, but generally interacts well with his peers. He is easily frustrated and emotionally impulsive. Jack has had several incidents of hitting, crying outbursts, and inappropriate behavior. Behavioral concerns with aggression, lying, arguments, and disruptive behavior were noted in preschool program at age 4. Okay na, ma'am.
Okay, sige. May previous slide ka mo, no? Okay,
Yes,
sige.
ma'am.
So, I will give the class 2 to 3 minutes to look into what is the possible diagnosis for Jack. Okay, and if you are ready to answer, so simply raise your hand. Okay, what are your insights? What are your possible guesses for the diagnosis? Wala? Ideas? Kita sa neurodevelopmental disorders. Anyone? What do you think? What are some key features that you have seen? Okay, Miss Oro. Sige.
Hello, ma'am. I I think ma'am ara siya ADHD
Okay.
or attention deficit or hyperactivity disorder because ma'am sa na-manifest niya ma'am may ara siya difficulty in listening which is ma-fall siya sa inattention
Oo.
and then may ara pagid siya ma'am constantly running around
Okay.
ma-fall siya sa hyperactivity na criteria.
Okay. Sige. Ano pag any more? Do you have any
Um,
more to add?
Wala na ma'am, okay na ma'am.
Okay, sige. What else? How about the others? What do you think is the diagnosis? Sige, Miss Senier.
So, good morning, ma'am. I think pareho lang man sa ginghambal kagina nga may ara siya ADHD
Mm-mm.
because ang nag-show siya symptoms of inattention wherein um, he has difficulty sustaining attention in task and also some wait na, hyperactivity and impulsivity wherein he is often constantly running around and often blurts out medyo often blurts out the questions I answers before questions had been completed daw pareho sila ma'am. That's all.
Okay, sige. How about the others who has other ideas?
It can also be ADHD with ODD combined, ma'am.
Okay, what's ODD?
Um, ODD is related to child's conduct or is oppositional defiant disorder. Although ADHD and ODD is different disorders, they can occur together, kano ma'am. And
You think?
I have researched some symptoms of the ODD and ADHD which was seen in the child that display the symptoms of both behavioral disorders, such as in ADHD, he has an ability to pay attention to school and has difficulty in focusing. Also, he is easily distracted and unorganized, and with ODD combined, he easily loses his temper and is easily annoyed. Ang ODD, daan niya kuno ma'am, is makita siya in how a child develops relationship with his family friends while ang ADHD is sa iya behavior. So I guess
Ah, wala.
na siya.
Oh, sige, thank you. Okay, how about the others? Other ideas pa? Sige, Miss Kindipan.
Good morning, ma'am. I also think it is ADHD. That has a combined presentation since the child exhibits behavior that fits the criteria for inattention and hyperactivity. Lang lang.
Okay, sige. So, group, uh, the group, can you reveal now what's the diagnosis? Thank you sa mga nag-answer. Sige.
Okay, so their answers are correct, ma'am. So Jack is diagnosed with ADHD or the attention deficit hyperactivity disorder. But in his case, he also presents with the ODD, which mentioned by Trisha, which is the oppositional defiant disorder. Okay, so ADHD is a persistent pattern of inattention and or hyperactivity impulsivity that interferes with functioning or development. Oppositional defiant disorder is a persistent pattern of angry or irritable mood, argumentative, or defiant disorder of vindictiveness. So here are the following DSM-5 diagnostic criteria for ADHD. So in criteria A1, which is sorry ma'am, may attention sa niya barangay.
Okay lang.
In criteria A1, which is inattention, Jack exhibits inattention which manifests behaviorally in ADHD, as he has difficulties with focusing, following instructions, and forgetful of his daily activities. So also, Jacks tend to be upset when he feels that he has been ignored and does not receive any recognition. And he also has a behavior of seeking attention that also led him to fall into this criteria. So next is the hyperactivity in criteria A2, which is hyperactivity. Jack often fidgets or squirms in his seats. He cannot stay seated and is hyper focus on things or activities of his interest. So therefore, his attention was drawn to something else. Also, he was described as restless because of his constantly running around. He also talks excessively that he would often blurt out answers before a question was completed that interrupts his classmates. So even though he wanted to stop, he can't do it because he cannot control his disorder. Next slide, please. So continuation. In criteria B, so several inattentive or hyperactive impulse symptoms are present prior to age of 12. So Jack is only 7 years old. Criteria C, several inattentive or hyperactive impulse symptoms are present in two or more settings. So in Jack's case, his mother reported that he has difficulties both at home and at school. Next, criteria D, there is a clear evidence that the symptoms interfere or reduce the quality of academic functioning. Even though Jack is intelligent and participates in different activities, he has still difficulties in his academic functioning, like the loss of focus inside the classroom. So, symptoms. A typo lang na siguro, ma'am, ang C. So, in the diagnostic criteria for ODD, criteria A pattern of angry, irritable mood, argumentative, defiant behavior, or vindictiveness. So Jack was reported to have emotional reactivity and confrontational behaviors demonstrated both at home and at school. B, the disturbance of behavior is associated with distress in the individual or other immediate social context or impacts negatively on social, educational, or other important areas of functioning. So Jack easily gets frustrated and emotionally impulsive. He has also had several incidents of hitting, crying, outbursts, and inappropriate behavior. So last is criteria C. The symptoms do not occur exclusively during the course of schizophrenia or another psychotic disorder and are not better explained by other mental disorder. Next.
Hi, ma'am. Pati on ako.
Yes po.
Okay, so these are the differential diagnosis. The first one that we have here is autism spectrum disorder. So ADHD and ASD has a lot of similar characteristics, such as, for example, inattentive, impulsive, fidgeting, difficulty in communication, trouble with schoolwork, and relationship. So, as mentioned, Jack has shown those characteristics, but children with ASD is only struggling to focus on the things that they don't have any interest in, and they also practice extent of order and as well as repetition in their routines, which Jack does not possess any of those other features. The second one is bipolar disorder. So bipolar disorder and ADHD has some matching symptoms like increase in energy or being on the go. They are also being easily distracted, talkative, and frequently interrupting others. So, exclusively rather in bipolar disorder, it primarily affects their mood and experience a cycle through different episodes of mania or hypomania and depression, which Jack doesn't experience those cycling symptoms. Mm, Um, the next one is intermittent explosive behavior. So ADHD and intermittent explosive behavior have the same levels of impulse and behavior, but however, individuals that has intermittent explosive behavior disorder tend to have much more serious aggression, which is not a characteristic of ADHD, which Jack has, or which Jack was diagnosed with. And the last one, language disorder. Language disorder is a communication disorder commonly present in children who have trouble understanding and speaking the language. Jack's inability to know his address or even home phone number, not being able to write his surname, and like what was mentioned earlier, Jack can only recognize few pre-primary words, which is just a symptom of ADHD. A common criteria, which is delayed learning ability due to his hyperactivity and inattention during classes.
So for the biopsychosocial factors, as mentioned before, so in the causes for the onset of ADHD and ODD cannot be specified, but different combination factors can be thought to be responsible. For ADHD, in biological causes, um, the genetics for ADHD in the relatives can be thought to be um, can be thought to be a influence for the onset of this ADHD, which Jack has an extended relative with a history of a diagnosis with ADHD disorder. However, genes are sufficient as causal factors. Still, the heritability for ADHD is still substantial. In ODD, as well as the individual family who have history of ADHD, conduct disorder, or mood disorder are susceptible to having ODD. And as mentioned, Jack has an extended family that had been diagnosed with ADHD and mental concerns, which could be a basis for the onset and signs of his symptoms. And also considering that Jack is an only child, his temperament or natural disposition could have played a genetic role in the development of DD. This could be noted that whenever he does not receive recognition or feels that he has been ignored, he gets upset. He also acts socially immature and demonstrate attention-seeking behavior. Or the psychological factors in ADHD, the factors such exposure to environmental toxins such as alcohol exposure, smoking, or neurotoxin during pregnancy could be possible influences for the onset of the ADHD. However, in Jack's mother, during her gestational period, it was not noted. But it could be also noted that Jack has difficulty in falling asleep and getting back to sleep, given and stays awake for at least an hour and a half, which could be a possible influences on the onset of symptoms. As stated in the DSM-5, that symptoms such as sleep disorder or nutritional deficiencies should be considered as possible influences on ADHD symptoms. But Jack was not diagnosed with sleep disorder. However, he still had difficult sleep difficulties, which could be mean something or could be attributable for his onset. Also, according to a study of Cortez, it has been recommended that assessment for ADHD requires evaluation of sleep. So, and as in ODD, also in ODD, it was not specified or elaborated the environmental background of Jack, his upbringing, parenting style, or the relationship that coexisted with them as a parent and child relationship. Therefore, it would be difficult to make environmental connection in the development of ADD. But it can be noted that Jack is usually invited to a social gathering, participates in physical activity, and has a good social interaction with his peer, which could mean something about Jack's environment. However, it is still difficult to make inferences with the incomplete environmental background. For social factors, in ADHD, Jack's social interactions are considered good, as he spends most of his time interacting with his friend. He also participates in physical activities such as swimming, running, and skating. He also often invited to parties as he enjoys participating in social gathering events. Although he regularly interacts well with his peer, he could be easily led and influenced by others. Also, he is noted as socially mature at times when he feels being ignored, which are the symptoms for ADHD. So according to psychology at Nemore Children Health, um, at times all kids have trouble paying attention, listening, sitting still, or waiting their turn. But kids with ADHD have trouble with these things almost all the time. They may have a tough time controlling their behaviors and get into trouble more. This could make it hard to do things like paying attention in class or get along with others. ODD, on the other hand, as mentioned, Jack is very defiant toward listening to instructions, generally interacts well with his peer, but generally interacts well with his peer. He is easily frustrated, emotionally impulsive, and has several incidents of hitting and crying, outbursts, and inappropriate behavior. According to John Hopkins Health System, many children tend to disobey, argue with parents, or defy authority. This may be often as they may be often behave this way when they are tired, hungry, or upset. But in children and teens with ODD, the symptoms happens more often. They interfere with learning and school adjustments. In some cases, they disrupt the child's relationship with others. That's all, ma'am.
Okay, thank you very much, childhood disorders group. So so far, do you have any questions with regards to the neurodevelopmental disorders or childhood disorders group? Okay. Okay. Wala man. Sige, so how, for our last presenter, wow, last na lang tayo. Last presenter, group for sexual disorders, are na di sila. Okay. Sige, so let's welcome Miss Belasa, Miss Bering, Miss Tamo, Mr. Bulanan, and their group in which they would talk about sexual dysfunctions, paraphilic disorders, and gender dysphoria. Think lag pa yung karat. Yan. Okay, sige. So you have the floor now.
Wait lang ma'am, hindi ko pa makita ang slide.
Okay.
Good morning ma'am. Dari na lang kumama base sa slide ko siguro.
Okay.
So hello everyone, good morning. So we are the last group that is going to present and our topic is about sexual dysfunction. So I'll read the case we've picked. A 79-year-old married man requested consultation because of a 5-year history of being unable to achieve orgasm or ejaculation with his wife. By himself, with intense stimulation, he is able to ejaculate, although it takes him much longer than it previously did. The patient reported a significant decrease in penile sensation. He was distressed by the delayed ejaculation, but not depressed or anxious. His wife was not concerned about his absent ejaculation, and she enjoyed their sexual encounters even if he did not experience orgasm or ejaculation with her. The patient characterized his marriage as long-standing and good. The couple had intercourse once every 10 days, and the patient reported having good erectile reliability and sexual desire. Okay na, ma'am.
Okay, sige. So, who can guess what I'll give you again 2 to 3 minutes to look into what is or what do you think is the problem with this 79-year-old? Okay. Any ideas? Ara na siya sa sexual. Okay, Mr. Palkat. Sige. What do you think?
Turn up. I think ma'am he is under delayed ejaculation.
Okay, why?
Kay based on diagnostic criteria on A, um, the two following symptoms nag-fit siya. So first is marked delay in ejaculation. So it is stated sa case na by himself with intense stimulation he is able to ejaculate although it takes him much longer than it previously did. So nag-fit siya dito. And next is marked infrequency or absence of ejaculation. So stated here that his wife was not concerned about his absent ejaculations. So she enjoyed their sexual intercourse even he did not experience orgasm or ejaculation. So makita nga wala siya kay sa ejaculation. So the symptoms in criterion A nakabutang sa criterion B nga persisted for a minimum duration of approximately 6 months. So ang ila is 5-year history na. So amo na siguro.
Okay, sige. Who has other diagnosis? Or who has other ideas? Mr. Palkat now. Okay. Sige, let's see what is the diagnosis.
So Mr. Palkat was right. So for the diagnosis and diagnostic criteria, the patient was diagnosed with delayed ejaculation with a specifier of acquired situational and mild delayed ejaculation. So the patient first meets criterion A number one, which is delayed ejaculation, since the patient is able to ejaculate on his own with strong stimulation, but it takes him considerably longer than it did previously. Next, criterion A number two was met, which is the infrequency or absence of ejaculation because the client is unable to achieve orgasm or ejaculation with his wife. Next patient meets the criterion B, which is that the symptoms in criterion A have persisted for a minimum duration of approximately 6 months. So as you can notice, the client's problem, which is that he has been unable to ejaculate, had persisted for 5 years. Next, the client meets the criterion C, which is that the symptoms in criterion A cause clinically significant distress in the individual. So in that case, the patient says that he was distressed by the delayed ejaculation, but not depressed or anxious. And lastly, the client meets the criterion D since his delayed ejaculation is not better explained by a non-sexual mental disorder or as a consequence of severe relationship distress, or other significant stressors, and is not attributable to the effects of substance or medication or another medical condition. So next slide. So next slide are the specifier. First is the acquired. So the disturbance began after a period of relatively normal sexual function, and next situational only occurs with certain types of stimulation, situation, or partners. Mild evidence of mild distress over the symptoms in criterion A. So it is acquired because the occurrence of his condition started in his 70s. It only means that before his 70s, he had normal sexual function, or he could normally ejaculate or orgasm. And it is situational because he is unable to achieve orgasm or ejaculation with his wife, but by himself with intense stimulation, he is able to ejaculate or orgasm. And also only mild because although he could not achieve ejaculation with his wife, so his wife still enjoyed their sexual encounters, and he could still achieve orgasm by himself. And more importantly, the patient characterized his marriage as long-standing and good. Next is the differential diagnosis. So we have first two things to ponder before diagnosing someone with delayed ejaculation and prevent misdiagnosis. First is another medical condition. So it is the inability to ejaculate can be caused by the interruption of the nerve supply to the genitals, such as can occur after traumatic or surgical injury to the lumbar sympathetic ganglia, abdominoperitoneal surgery, or lumbar sympathectomy, and a number of neurodegenerative diseases include alcoholic neuropathy. Next is the substance or the medical use. So a number of pharmacological agents such as antidepressants, antipsychotics, alpha sympathetic drugs, and opioid drugs can cause ejaculatory problems. So use delayed ejaculation must not be a cause of any medical condition such as mentioned. So this is based on criterion D of delayed ejaculation criteria for diagnosis. For example, diabetes can cause retrograde ejaculation, in which poor blood sugar control over a long-term period leads to neuropathy of the bladder. So in terms of medical use, according to one research, na ang drugs may have negative effects on male libido, erection, ejaculation, and orgasm. So both of these does not fit the criteria for delayed ejaculation. So next is the erectile disorder. So difficulty in obtaining an erection during sexual activity. So in our case, delayed ejaculation only takes time, and next is difficulty in maintaining an erection until the completion of sexual activity, decrease in erectile rigidity too. So in delayed ejaculation, so erectile rigidity is present, as you can notice sa amon nga case. So next slide. So we have three ng dysfunction or orgasm to consider. So dysfunction with orgasm, ejaculate occurs in the genitals where areas the experience of orgasm is believed to be primarily subjective. So first is the retrograde ejaculation. So retrograde ejaculation doesn't affect your ability to get an erection or have an orgasm, but when you climax, semen goes into your bladder instead of coming out of your penis. Next is the premature ejaculation. So when the man ejaculates within a minute of vaginal penetration, or more generally, when he ejaculates sooner than he or his partner would like. Next is the anejaculation, when no ejaculation occurs at sexual climax, brought about by someone acquired conditions such as diabetes or multiple sclerosis. So delayed ejaculation is when ejaculation is retarded beyond a reasonable period after sexual stimulation. So compared to retrograde ejaculation, it is due to the wrong flow of semen to the bladder, while premature ejaculation, on the other hand, is when within a minute of vaginal penetration, or more generally, when he ejaculates sooner than he or his partner would like. And lastly, an ejaculation is no ejaculation at all. Next na.
So the biopsychosocial factors is age. As a biological factor is age. Since ang patient is 79 years old na siya, ang iya nga testosterone levels nag-decline na gid. Kay halin sang iya nga 50s nga age, niya pala nga daan, nag-start na siya decline. Another pagid is the patient reported significant decrease in penile sensitivity. So as men age, ang sensitivity nila naga-reduce pagid, which is amo na siyang ginareklamo kato nga patient. Then sa iya, achieving an erection takes longer kag naga-require gid sang more intense, continuous kag lengthy nga physical stimulation. Plus, ang iya nga erections hindi na as firm like sa iya earlier nga stage of life kay given again sa iya nga age which is 79. Sa pagid sa iya nga age, hindi na siya ka-experience ka-ejaculation when he and his wife had an intercourse. So next is psychological factors, which is the emotional distress and masturbatory patterns and fantasy life. Emotional distress, the patient was distressed about being unable to reach orgasm. And because of stress niya nga ni, ang iya nga delayed ejaculation might worsen pagid. Then we have masturbatory patterns and fantasy life. So the patient reported nga, if siya lang, wala iya partner with intense stimulation, he is able to ejaculate compared to his sexual acts with his wife. Diri ang reality of sex with his wife kag ang iyang sexual fantasies while masturbating and ejaculating, wala gatugma. So it differs in speed and pressure, in duration, and in intensity necessary to produce an orgasm. And maybe his methods might be very dissimilar to what men might experience and therefore are very difficult to reproduce in partner-related sexual activity. Plus, the disparity between the man's fantasy life and his real world may include fantasies concerning his partner's attractiveness, body type, sexual orientation, and a specific sex activity performed. Next is social factors. Ang iyang social relationship, ang iyang relationship sa wife niya is good and wala reklamo iya wife sa delayed nga pag-ejaculate niya. And it was also reported nga his wife still enjoyed their sexual encounters even if that was his case, delayed ejaculation. Yun lang. Thank you.
Okay, sige. Thank you very much everyone who uh, participated and everyone who presented sa aton nga case conference. So before we end with um our session, so do you have any questions or do you have any concern? Questions or concerns regarding the mga projects or sorry. Wala man. Okay, Mr. Bolanadi, I think you raised your hand. Okay. Yes.
Yes, ma'am. Good afternoon, good noon, ma'am. Mamangkot na kami, ma'am. Like, um, ano nga mga example sang like isa lang ma'am ka example sang issue regarding sang abnormal psych.
Pwede ka mo katakol sang isa ka disorder or pwede ka mo katakol about a specific issue in mental health. Okay, so amo na. Na gets ba? Pwede man mga wellness, doon mo na. About mga mindfulness, mga strategies on mental health, coping, ganun. Mga issues mo na. Did I answer your question? Mr. Bulanadi?
Yes, ma'am.
Okay, sino tong
Thank
isa?
you din, ma'am.
Krishlyn? Yes?
Same question naman, ma'am. Okay na po.
Okay
Thank
na.
you.
Sige, may other concerns pa? Wala naman. Sige, so I'll just... Okay, don't forget ang mga submissions ninyo before the end of the term. And also, God bless the exam. So study well, study the disorders, know what are the common signs and symptoms, and at the same time know what are the ano dayon, what are the differences kapin gina sa mga differential diagnosis. So know what makes it rule in and rule out. So rule in all the common signs and symptoms and rule out ninyo kung anong mga rule out ninyo ang mga those symptoms nga will make it nga hindi siya amo na nga disorder. Okay, so please say present if your name is called. Abatay.
Present, ma'am.
Okay, abordo. Abordo.
Present, ma'am.
Okay.